cares about is the health care bill. Could you tell us, obviously, all of you are going to say you want to get rid of Obamacare. We all agree. But would you identify for us, what do you think is at the core wrong with President Obama's approach to health care? And how do you think, if Republicans win the presidency in both houses, we could repeal it? What do you think we should do about it? Rodney?
Like I said in my remarks, we need to repeal Obamacare. The core problem with Obamacare is that we, as Americans, will cede control of where and when to seek medical treatment to faceless bureaucrats. I don't think America is ready for that, and we are seriously not ready for the $2.6 trillion price tag that Obamacare is going to cost us. Yes, we can repeal it. There are some good provisions within the Affordable Health Care Act, covering pre-existing conditions, for example. Those are the things that we have to figure out how to create a market-based safety net, healthcare safety net, that helps us to deal with the uninsured and the underinsured in this country. And we can do that in a much more cost-effective way that I guarantee you won't cost anywhere close to $2.6 trillion. And then we address the real problem with healthcare in America, which is the uninsured, underinsured, and the underserved.
So you agree with the concept that the federal government should dictate to an insurance company that they take on risk with a person who is already a proven risk through not recognizing pre-existing conditions?
I agree that that is a provision that needs to be looked at. And I agree that that's a provision that should possibly be kept. I think Americans, if you put together a market-based healthcare safety net, the cost to the insurance company isn't going to be as high as what they're imagining now with Obamacare. Yes?
What would you do to correct the healthcare system if Obamacare goes away and you got to participate in writing a new Republican bill?
First off, I would utilize community health centers. Community health centers will provide the healthcare safety net for those who can't obtain primary health care and go to the ERs. My wife can tell you from her service in the ER, people will come in when there's a clinic next door. May open 10 minutes later. That's too long to wait. So the highest cost in our healthcare delivery system is the emergency room. And you know what? They have to be served.
Kathy, how would you address healthcare if you got to influence starting over?
Sure. Well, first of all, let me say, well, hopefully in a few weeks to months that this will be overturned by the high courts. I believe it's unconstitutional to allow someone to be forced to have health care insurance. I think that's it's not a right to have health care in this country, and it's your privilege and it's your choice. I agree with Rodney said. I also think that I've seen the ER time, and I've worked in hospital, and I've seen the long lines, the waiting. I do think those community-based healthcare sites where you can go in, like right now at Walgreens, you can go into Walgreens, and if you're just not feeling well with the flu, you can see a physician assistant. My son's going to be a PA in about a year. I think that they're great, and you can see a PA, and you can get treated, and you can go on your way, and it is crippling the costs. I see that my future son-in-law is an EMT. Do you know how many times people call the ambulance for a cold, for I couldn't get my finger out of the jar? I mean, it is crazy, and the cost. The frequent flyers for the ambulance service is out of control. So we need to hone all of that in, and we need to look at it. So what I would do is I do like certain parts of it. I like the fact that you can keep your child on till maybe 26 is maybe a little too old for me, but say 23 or 24. I like that idea because remember of the underemployment we talked about with the college students coming out. I do like that. I think you should be able to port it across state lines. I'm a business employer. I do not think that insurance should be attached to a business, because when my employee leaves, guess what? They have to go find new business and find new health care. Why can't we have a system where you can just take that insurance with you? I think these things, especially as an employer, as a medical professional, these are things I'm passionate about.
Erica, how would you affect healthcare when you have the voice?
Well, focusing on the proper role of government and separation of powers is really important to me. So I think the fundamental thing wrong with Obamacare is that it violates the Commerce Clause. It's essentially the federal government forcing people into commerce for the sole purpose of regulating. And to me, the problem is that if the Supreme Court upheld that, there would essentially be no limits on the power of the federal government. I do think that dealing with healthcare is more of a state's issue, because the state does have certain powers that the federal government does not. The state has police powers where the federal government does not. I think Obamacare does have to be repealed if it's not invalidated. I think that the individual mandate will be held unconstitutional by the Supreme Court. Whether they decide to sever that from the rest of the bill and kick it back to Congress remains another story. But I think letting the states focus on solutions is really important. I have some ideas that I think states should focus on, but I don't think that they're necessarily appropriate in terms of the role of federal government. Because really what's fundamentally wrong with Obamacare is that it's federal government exercising powers that the Constitution does not afford it.
So if this were repealed, or the new Republican Congress and President repealed it, you would say that Congress should do nothing and just go back to what we had? Or, as Rodney mentioned, and Kathy, some provisions, what would you do?
I don't think the federal government should do nothing, but I would not be supportive of writing an entirely new bill, because the reality is what's wrong with Obamacare isn't just the substance of it. There are some good policies in it, but the question is it the role of federal government to effectuate it, or is it the role of state government? And so just saying there are parts of Obamacare that we like, that we keep, still seems to me to be letting the federal government exercise powers the Constitution does not afford it. I do think that community health centers at the state level are really important. I think that focusing much more on preventative health care measures is important, because then people don't feel so reliant upon going into the emergency room for services that really could have been dealt with earlier. But I think really healthcare, it's not just about policies that we like and letting people stay on insurance longer. It's about which government entity has this power under the Constitution, and standing on those constitutional principles is really important to me.
Moving to generally the